So this year, mosquitoes have been linked to two dangerous illnesses. There's West Nile virus and Eastern equine encephalitis, or also known as Triple E. I'm now joined by infectious disease physician at WellSpan Health, Dr. Raghav Tirupati. Dr. Tirupati, thank you so much for joining us.
Thank you, Tasmin, for having me.
Yeah, so first, can you explain the difference between the two?
I think there is more similarity than a difference. Both are viruses and both cause infections between late spring to early fall. And both are caused by mosquito bites that usually first bite the birds and then bite humans or animals, transmitting the infection. Both of these viruses cause flu-like symptoms in most patients with headache, body pains, and aches, as well as GI symptoms like nausea, vomiting, and diarrhea. But unfortunately, in about 1% of these patients, it can cause what we call as neuroinvasive disease, where it can invade the brain and cause infection of the brain, which we call encephalitis or meningitis.
And doctor, so right now the CDC is reporting 4 total human cases in the U.S. Yesterday reported on someone who had died in New Hampshire. There also is a reported case in New Jersey. What's the treatment?
Unfortunately, most of these viral infections are self-limited, and the treatment here includes a lot of rest, fluids, and supportive care, including painkillers. There are no definitive antibiotics or antimicrobials to treat this type of an infection. Fortunately, these infections are very rare, and only 1% of those patients who develop these infections develop severe disease, with most of them recovering okay.
And for Triple E, what should people do as far as prevention goes?
People should definitely wear clothing that covers their arms and legs to prevent mosquito bites, DEET-based repellents when you're outdoors. Try to avoid dawn and dusk because those are the times when mosquito bites are most prevalent or mosquitoes are most active. Avoid water pooling in and around the house, like bird baths or containers containing water. So those are the few things I would ask people to do.
Doctor, let's talk about the West Nile virus now. That's not a word that people are more familiar with. So in the U.S., the CDC says there's a total of 289 total human cases of just West Nile virus. In Pennsylvania, there is a reported 12 cases. Of those numbers, 2 of them actually have been reported in Lancaster County. Can you talk about the signs and symptoms from West Nile virus? Are they different from Triple E?
So West Nile virus also causes very similar symptoms to the Triple E, which is fever, body pains, aches, GI symptoms in majority of the patients who are symptomatic. But the good thing is most 8 out of 10 patients who get infected with this virus don't even show symptoms. However, unfortunate 1% of these patients, and the most susceptible ones being those who have diabetes, who have kidney transplant or other transplants, who have been on chemotherapy, develop severe disease. And these patients can develop what we call as neuroinvasive disease, which is infection of the brain and the lining of the brain, which is encephalitis or meningitis. And these patients can develop significantly bad outcomes, including death sometimes. One of the peculiar presentations of West Nile virus is a polio-like illness where you develop one-sided weakness or numbness, what we call as flaccid myelitis. And these patients could, for the most part, recover their function over a period of time, but there is a few patients who have permanent neurological deficits or permanent weakness from this virus.
Can you talk about the sprays? Do you recommend sprays with DEET in them? Do they actually help?
Definitely, I think a DEET-based spray is very vital when you're planning an outdoor day, or if you're spending a lot of time in outdoors where we would be prone to mosquito bites, like wooded areas or swampy areas or wetlands. So I would definitely recommend a DEET-based spray. CDC has a whole list of EPA-approved mosquito repellents that you can use. I would encourage all of you to look into that list.
One last quick question. For young children, what should we do then with mosquito repellent in the DEET? Because I don't know if it's safe to really spray kids with them.
There are different concentrations of DEET even for kids, and other non-DEET-based mosquito repellents, which are natural and which could be easily effective. Equally effective. So I would encourage you to use one of those repellents. It's much better than not using a repellent.
All right, Dr. Raghav Tirupati, thank you so much for your time. Really appreciate it.
You're welcome. Thank you.